Hi everyone, welcome back to iMumz Ask Me Anything session. So today we have another important topic and a very special doctor with us. Dr. Aparna is faculty at AIMS in Delhi, and she's been an obstetrician and gynecologist practicing for past several years, helped so many women deliver healthy babies. So, her specialization definitely happens to be IVF. So, over to you, ma'am. Please go ahead and share your journey with them.
So a very good evening to all of you, and I'm happy to be here again. I have previously been here once, so it's been a pleasure. So I will today be talking about taking care of IVF pregnancy. So I will put on record that I am not an IVF specialist, but I take care of the baby. So my specialty is fetal medicine. So I take care of high risk pregnancies. So when we actually talk about IVF pregnancies, there are five things that, if you really want to talk about a few things that come to your mind, you would like to know, are the IVF pregnancies at higher risk in terms of the mother being at high risk, the baby being at high risk, with increasing number of pregnancies being conceived through IVF? Also, do they need extra tests in terms of blood tests or ultrasound? Do they need extra visits during pregnancies? What should be the timing of delivery? And does the mode of delivery differ? Now, some very basic facts about IVF pregnancy is that because, these pregnancies have conceived after a long time, they do carry a higher psychological and financial burden. More women aged 35 or more. So we have to understand that, these women may be 35 years or more, so they have higher risk in terms of the mother and the baby, and the babies who have conceived through IVF. And there is another special procedure within the IVF which is called as the ICSI. So these babies are known to have increased risk of chromosomal malformations. That means these babies are known to be more malformed. And also these IVF babies have higher rate of multiple pregnancies. So what is multiple pregnancies? Twins or triplets. So, and you would imagine that having a multiple pregnancy or two babies or three babies would increase the risk of pregnancies. Also, it has been seen that the complications would be more in these pregnancies. And also, if you want to, the parents who come to us after IVF are usually so high strung that if I want to tell them that, okay, I would like to do some tests in your baby, they would also say that, no, doctor, I don't want to undergo any extra needle prick or any extra test in my baby. So they are generally a little more anxious than your normal average couple. So, coming to our first question, are they at higher risk? So, yes, I would say that those babies are at little bit of higher risk of congenital anomalies. That means they would be little more of those babies will have little more incidence of being malformed. Preterm birth, that means birth before 37 weeks. Spontaneous preterm birth before 32 weeks. So 32 weeks is what you would call, say, 8 months pregnancy. So there is chance that the baby might come out before time. Low birth weight, that means that the baby might be smaller in weight, that is less than 2500 or even less than 1500 as compared to your normal average pregnancy. And what about the mother? It has been seen that there is increased risk of diabetes in the mother, increased risk of blood pressure, and delivery by a cesarean is more common in an IVF mother. And something called a placenta previa, that means the placenta, which actually provides food to the baby, is slightly on the lower side, so there is increased risk of bleeding in the mother. Now the next question is that, do you need extra tests to the baby? Now we know that in a normal pregnancy, you would require something like 8 visits in total. So what we normally do is that in this pregnancy, in an IVF pregnancy also, we would say that in terms of the actual number of visits, we would not want you to increase the total number of visits. But yes, per visit, we would want to do some things which are extra. So these are certain standard recommendations, some nutritional interventions, some maternal fetal assessments. That means how do you evaluate the mother and the baby, what preventive measures you would like to take, and some health interventions. That means what medications you would like to give to the baby or the mother to improve the quality of care is definitely slightly more in terms of IVF pregnancy. Now, blood tests. So, blood test doing a hemoglobin is certainly the same for both an IVF and a normal pregnancy. Doing a urine culture is also the same for both IVF and a normal pregnancy. Again, we should clearly ask for any psychological stresses that the mother might be undergoing. Testing for blood sugars and gestational diabetes is the same. Again, any substance abuse should be asked. Any alcohol use, tobacco. Testing for HIV is strongly recommended. Another very important aspect that I would again recommend is screening. You know, screening is something that is very, very important that we now talk about. So when a mother comes to us early on in the pregnancy, say in the first 3 months, so we call something like an aneuploidy screening. So that is, we screen for Down syndrome. Now, what is Down syndrome? So Down syndrome is something like which is the most common disability in a child, or when you see a lot of babies who have special children. So aneuploidy is one of the commonest cause of a disability in child these days. So we screen for aneuploidy in the first 3 months, 3 to 5 months. So this is a good screening opportunity to screen for the baby. And this is really important because pregnancies who have conceived by IVF present really some difficulties in screening in terms, and when you compare them with the normal pregnancy. Also, we need to screen for whether the mother is going to develop high blood pressure. So that is the point number 2. Again, I will screen whether the baby is going to develop any growth restriction. So whether the baby is going to be small. And I will screen for diabetes by doing a special type of blood test, which is called as glucose tolerance test. And I will screen for malformations in the baby. That means whether my baby is well made by doing 2 ultrasounds, one at 3 months and the other at 5 months. And then I will screen for preterm birth by a special test in the ultrasound, which is called the cervical length. So if we remember these 6 things for screening opportunities, especially in IVF pregnancies, we are happy that, okay, we are taking good care. Now, I will give some importance to the point number 1, which is screening for Down syndrome or aneuploidy screening in IVF pregnancies, because this is very, very important point from the point of view, because IVF pregnancies differ from normal pregnancies in this particular aspect. So if you see, most of the IVF mothers would be slightly on the higher side of age. So at 35 years, the risk of having a baby who is the Down syndrome is 1 in 250, which is quite high if you compare that with a lower age mother. And if you see, T21 or the Down syndrome accounts for 50% of the most common chromosomal abnormality. So this is why we are really worried about the Down syndrome. And to test for Down syndrome, we do certain tests at around 12 weeks of gestation, that is 12 months, 3 months. And then we do the another test at around, say, 4 months. So 16 weeks. So remember these 2 gestations. One is 3 months and one is around 4 months. But what happens in IVF pregnancy? In all types of IVF pregnancies, these markers, these blood tests differ from a normal pregnancy to this pregnancy. And that's why it becomes very, very important that we tell the doctor and the lab that, okay, this is an IVF pregnancy, so this has to be interpreted differently. So how it matters to you is that when you first get your test done, the report might come as high risk, and then your anxiety level is very, very increased. So I'm a fetal medicine person, and a lot of IVF couples come to me and they tell me that, ma'am, my test has become positive. So I counsel them that no, it is all right. We will conduct some further tests which will tell you that, okay, it is all right. And we will confirm this. And this is not to tell you that, your baby is absolutely affected. And now there's something called NIPT. So what is NIPT? NIPT is a test which will test your blood and will tell you about the DNA of the baby that you are carrying. Now, this is a very, very useful test because it can tell you what is the DNA of the baby that you are carrying. It has very limited applications because it can tell you whether your baby has Down syndrome or not. So, in IVF pregnancies, it is useful, definitely it is useful, but then the failure rate as compared to a normal pregnancy is slightly higher. So in a normal pregnancy, NIPT is more useful. In IVF pregnancy, it is slightly less useful. But yes, if we are anxious about the baby and we don't want to put in needles inside the abdomen and test the baby itself, you can go for this test also. Another very important about IVF pregnancy aspect is the twin pregnancy. Now we understand that if a pregnancy has happened by IVF, it is very, very, compared to a normal pregnancy, it is more likely to have a twin pregnancy. Now, twin pregnancy has higher chances of complications. But while you monitor for the maternal complications, it is very important that you continue screening for twins for Down syndrome by how you would do like a singleton. So, just because it is IVF, just because it is twins, we should not leave the screening. We should do the blood test at 3 months of gestation for twin pregnancy. So, please remember that certain blood tests need to be done for IVF pregnancies at 3 months and ultrasound at 3 months and then again at 5 months. So these are certain things that are very, very important. Now, do they need extra visits? Point number 3, to the doctors. Now we know that we go to the doctor at 3 months, we go to the doctor at 5 months, and then as and when the doctor would call you, probably at 7 months and 8 months and 9 months. But if it is an IVF pregnancy, do we need extra visits? Well, IVF, you see here in the green box that it is slightly a higher risk factor for the baby to be smaller towards the end of your pregnancy. So, we would like you to have slightly more number of visits as per your doctor. So there are certain number of risk factors which can put your baby at a higher risk of growth, lag. So that means your baby might be small. So this is what we assess. So at your first visit of 3 months, if you have some other risk factors along with you being IVF, your doctor might like to put you on aspirin. If you do not have those risk factors, you will not be put on aspirin. However, you will be again reassessed at 5 months. So there is a reassessment at 5 months to see if you have developed any more risk factors, which include some ultrasounds. And then the doctor might want to see you more frequently than, at 1 month or maybe 6 weeks. So the doctor might like to see you 2 to 3 weekly and see whether the baby is growing appropriately. So IVF is a risk factor in terms of maternal and the baby being at a lower growth. The next question is, when do you want to deliver the baby? Do you want to continue for 9 months? Do you want to continue before and deliver early? Well, it has been seen that IVF pregnancies have got a slightly increased risk of stillbirth. So what we normally do is 8 months onward, we have to do a routine monitoring, slightly, intensive monitoring of the baby, which we do by a weekly ultrasound, which we call as biophysical profile. So how the baby is moving, how is the heart rate of the baby, so that we know that the baby is doing fine. But we also do not go beyond 40 weeks. And as we have seen previously, there is an increased risk of preterm delivery inherently. Like anyway, the baby is at risk. So the baby might come out before 37 weeks. But we do not want to go beyond 40 weeks. So we will monitor the baby very, very closely sometime after, say, 32 weeks. And by 40 weeks, we would like to deliver. Now, the next thing would be, how do you want to deliver? Now, we come across IVF patients so often, and they are so high strung. Most of them, they have gone through a lot, they have done IVF, and there's so many questions in their mind. And they would say, Doctor, I don't want to take any risk. And should I go for a cesarean section? So, I would like to say that yes, I mean, a lot of patients do undergo cesarean section, and it has been seen that cesarean delivery is a common choice. But now, increasingly, people opt for a vaginal delivery because it has been seen that vaginal delivery is as safe as a cesarean delivery. So it is all about, how your baby is doing, whether the mother is doing fine, whether the mother has some complications like diabetes, hypertension, what is the weight of the mother, how prepared the mother is for a vaginal delivery. So if you are in a setup where you have the facilities to manage complications, and you are in a state of mind where you can think and you can go for a vaginal delivery, I think vaginal delivery is a feasible and a very good alternative to deliver. During the delivery, it is very, very important to have a very good setup, have a good obstetrician to manage your delivery, because there are complications like, if you have a twin pregnancy, pph, increased blood loss can happen. So we need to be very careful. So the crux of the matter is that IVF pregnancies from the beginning to the end need to be monitored very nicely at a place where there is an expertise in fetal medicine available, a very good obstetrician who can manage high risk obstetrics, and neonatologist is also available to help you manage babies who are even born a little bit of a preterm, that is before delivery. So these are some of the points that I would like to put forward, and most welcome to answer your questions. Thank you.
Thank you so much, ma'am. Uh, I'll quickly jump into the questions right away. So Neha says, "Hi ma'am, I'm 35 years and my IVF pregnancy currently in 29th week. Growth scan shows increased abdominal circumference, 4 SD. HbA1c is 5.3 and glucose tolerance test was normal. What should I do?"
So, Neha, thank you for the question. See, if your abdominal circumference is as at fourth standard deviation, so I think it is quite big. So we really need to know what is happening. How is the estimated fetal weight overall, right? It is not just abdominal circumference. So what is the weight? What is your weight? So we generally say that there is something called a macrosomia, right? So the baby being big. So if the baby is big, so either it is diabetes or the mother is slightly on the higher side. See the obesity in the mother, right? Or there are some, certain problems in the baby which can lead to increased weight. If you have ruled out diabetes, so what I would suggest is that keep on following. So now, because you're already 29 weeks, there is nothing very actively that you can do about it. But your prime concern right now is keep monitoring your blood sugars, right, for your own benefit. If you are little on the higher side of the weight, please keep a watch on the weight. Consult a dietitian. Good, take a good diet. Most important, I would like to say that please find a good estimation of the fetal weight around the time of birth. Now that is the most important thing that I would like you to do at this point in time. Now, why? Because it has been seen that if your baby is more than 4 kgs, right, at the time of birth, so this I'm talking about Indian babies, like Western babies, it is 4.5. But if your baby is more than 4 kgs at the time of birth, estimated weight, then your baby is in the danger of getting stuck. So you might not be able to deliver the baby vaginally. Or right, that is if you're a diabetic, and if you're a non-diabetic, it is 4.5 kgs. So please be very careful. Have a good estimation of fetal weight around the time of birth, because whatever it is, you cannot change the course of management in pregnancy. But what is most important is your mode of delivery at the time of birth, which will determine the outcome of your baby. So please be very careful on that.
Thank you, ma'am. Actually, she has also shared an update that the fetal weight right now is around 1600 grams. and
Right.
she's been advised to have restricted activity because of an episode of threatened abortion at 6 weeks. So she also
So,
had hemorrhage.
see, Neha, threatened abortion at 6 weeks cannot really continue till 29 weeks. So I think you should, and so take care of your weight and do not have excessive weight gain in pregnancy. That's the biggest cause for macrosomia. And so just take care of your weight, get a good dietitian, continue. If your placenta is not low lying, if you're not at threatened abortion at 6 weeks is over by now. So just if you're not having, a low lying placenta or any other cause for worry, you should have normal activity. Do not restrict yourself to the bed. Just do your normal physical activity. 1600 grams at this stage at 29 weeks is fine. It's not good, it's not really bad, but I do not understand why the AC is so much. So we really need to look into it. But just follow the baby's trajectory. So it's not like a single weight which is important, so you need to repeat the weight after 2 weeks and see how the baby is growing, which is more important. But just remember the cutoff of a 4 kg at term to determine what should be the route of delivery for you.
Thank you, ma'am. So Kirti has a question for you. I'm 28 years old and this is my second pregnancy in the eighth. I'm in the 8th month. From the last week, I've been feeling a lot of pressure in my lower abdomen and sometimes I feel pain as well. So please advise.
So, Kirti, as pregnancy progresses, the baby's head keeps going down. So, most likely, that is number one cause of pain and heaviness in the lower abdomen. Now, if that is persistent, if you're getting too much troubled by it, the other reason is definitely a urinary tract infection. So along with pain and heaviness, you would also feel some kind of burning. So if you think that it is too much sometimes, so just get the urine routine done. Anyway, we do advise a urine routine twice in pregnancy, first in the first trimester, once in the last trimester, to rule out an asymptomatic bacteriuria. That is important. Thirdly, I would also say that, in pregnancy, there are certain non-specific aches and pains that really cannot be helped. And that is also because of a lot of joint laxity, which happens because of hormonal changes, which do happen in pregnancy because of the progesterone. And fourth point, I would like to say that what is your level of activity? Do have some supervised exercises and yoga in pregnancy. So these are some of the things that I would like to tell you.
Thank you, ma'am. And Riddhi says, "Hi doctor, I am 32 weeks pregnant. My last visit to my doctor was on 25th of May. Now she wants to know when is the next time she should be visiting her doctor. Like she wants to know like when will I know when should I go to the hospital?"
Right. So, Riddhi, a very good question, but I would also like to say that, in COVID, okay, because we are living in COVID times, so we should classify ourselves on the go. At that moment we get pregnant, we should classify ourselves whether we are high risk or we are low risk. Okay, anytime that status can change. But if we are low risk, let us not have unnecessary visits to the doctors. um, and try and video consult, online consults, teleconsult as much as possible. So, as I mentioned, we should have just 4 visits to the doctor in low risk pregnancy. That is at 12 weeks, 20 weeks, 28 weeks, and 36 weeks. Please remember, for every low risk pregnant female, for all practical purposes, these 4 visits are more than enough. Now, at any point in time, you feel that you've become a high risk patient because of the mother or the baby, then in that case, please be guided by your doctor. Now, if you feel, Kirti, that there is something wrong with you or the baby, then you visit. Otherwise, after I have seen you at 32 weeks, I have no reason to believe that I will see you before 36 weeks.
Thank you, ma'am. Moving on to the next question here. Yeah, Shravani is asking, I'm planning IVF. My embryos are frozen currently. Can I go for COVID vaccination or shall I go without it?
No, no, there is absolutely no doubt about it. Please go ahead for the vaccination. I would really encourage each and every one of you who is not pregnant currently to please go ahead with the vaccination. So let me be very clear on the vaccination status. Everybody who's lactating, who's breastfeeding, who's feeding your baby can go for vaccination. Everybody who's not pregnant should go for vaccination. Please do not delay vaccination because you're planning pregnancy. Currently, the outcomes during pregnancy, what we are seeing comparing to the first wave, are really, really, not very good. And anytime now, we are going to come up with the advisory that vaccination can be done in pregnancy. So, as of today, as of this date, I cannot say that even pregnant women can take vaccination, but anytime now, within the next few days there will be an advisory on that. But please, as of today, our primary objective should be get vaccinated. Nothing should stop you from getting vaccinated.
Thank you, ma'am. Next question here is by Sashi. She is asking, uh, how much should the blood pressure for 19th week of pregnancy be? I have 92 by 60. Is it okay?
Yes, so basically there is an upper limit of blood pressure in pregnancy, and it should not be more than 140 to 90. So the blood pressure, the systolic blood pressure, the upper blood pressure should not be more than 140, and the lower one, or the diastolic pressure, should not be more than 90. So we are worried about that with what we call as preeclampsia. So please remember, in the second trimester of pregnancy, that is between 12 to 28 weeks, between 12 to 28 weeks, the blood pressure can drop naturally by up to 10 millimeters of mercury. And then in third trimester, it rises again. So we are more worried about the upper limit. Now the lower limit. So in Indian women, the lower limit could be anything. 90 by 60 is something that we see day in and day out in our OPDs, and women are walking just fine. So there is nothing like a low blood pressure. So unless you are fainting, unless you are having fainting attacks, or your blood pressure is normally 110 and now it is 90, so something that it has come down, or you've had, you were sitting in a sun, or you had a heat stroke. So there is nothing like, I say, low blood pressure, or that kind of a thing. So I would not be worried about a 90 by 60 blood pressure. Some people generally have low blood pressure, but if you people are having blood pressure apparatus at home, I would recommend take good standard company blood pressure machines. When you want to take blood pressure, sit at one place for 5 minutes, relax, take the blood pressure in a sitting position. Do not take blood pressures in lying down or reclining position. Keep the blood pressure on the your hand should be on the table, and the machine should be put when at the your hand should be at the level of your heart. So you should take certain precautions when you take the blood pressure, when you monitor the blood pressure, and keep a note, a diary of your blood pressure record. So it's good that you're recording your blood pressure, but don't get too worried about it. So I'm not too worried about your lower blood pressure, as long as you're walking, talking, doing your normal daily work. There's nothing like a low blood pressure. So high blood pressure more than 140 by 90 is something that you should immediately report to your obstetrician.
Thank you, ma'am. The next question here is Geeta says, I am pregnant by IVF and there are triplets. Fetal reduction was done for one on 19th of May, but today doctor told all three are alive. She will repeat the process and told to do a cervical cerclage after reduction. Is it necessary? What is the effect on the baby's growth? Does IVF pregnancy have adverse effect on baby's growth? She's asking. Also, she wants to know weekly scan, will it affect the baby? Because for IVF, they keep checking probably weekly.
Yes. So, very good question. And I would have wanted to cover this part, but I thought it is too complicated to actually cover this part for general public. But I think I should have. So yes, triplets can happen in IVF. Sometimes you put two, they become three, or you put three, and everybody comes out. Uh, as a rule, you should not carry on triplets because it has been seen that triplets has 100% prematurity rate. So what is prematurity rate? That all of your babies will deliver before time, and then uh, those babies will be in the nursery for like months together. If a baby has to live properly, the baby has to continue or deliver beyond 34 weeks at least. That is the minimum good time that I'm talking about. Okay, so 32-week baby also survive, 30 weeks of baby also survive, but to have a decent good outcome. Now triplets has been seen to kind of deliver somewhere around 26 to 27 weeks, and all three of them will deliver at 26 to 27 weeks, and it is so common to happen. Because you have three babies, the liker will be more, the mother will be stressed out, mother will be over distended, there will be increased liker, and it happens to us so commonly that the patients, they do not understand, and initially they will refuse reduction because obviously they have conceived by IVF, and they will fear that okay, the reduction will lead to some amount of pregnancy loss. Now please understand the numbers. If I do a reduction, the chances of the entire pregnancy getting lost is 3 to 4%. So 3 to 4 out of 100. That is the risk of abortion. But if I continue a triplet, the chances of pregnancies ending up in a preterm delivery is 100%. So we end up with three babies who are some 600 to 700 grammars. So we need to understand that how important the reduction is. If you reduce one baby, you are giving a very, very, very good chance of survival to the other two. If you don't, then you are jeopardizing the lives of all three of them. So doing a reduction is a very practical thing, and we do reduction on every triplet that is happening, and that is managing to come to us actually. So very recently we had a triplet who came to us at 26 weeks, and we wanted to even reduce that, but turned out to be COVID positive, and some things did not work out. So things, if they do come to us on time, we do manage to do everything, and we do reduce, and we have very good outcomes. But and that lady, she actually delivered after 7 days. So it is a fact. So please understand that the numbers, and you need to understand that triplet is not something which is viable to continue. It is, if you are in so please go ahead with the reduction. And this is something that and when I talk about the risk of abortion, 3 to 4% risk of abortion, that is a risk that we have to take as a, that's a risk, that's a procedural risk to take. And ultrasound is safe in pregnancy. Ultrasound does not have any effect on the fetus. So even if your doctor is doing an ultrasound every week, that's fine.
Thank you, ma'am. I think she had one more question about cervical cerclage. So it is a part of the fetal reduction, or she wanted to know if she should go ahead with that because the doctor is suggesting it.
Yes. So cervical cerclage is done in cases your cervical length is short. So if you remember my presentation, I said something about screening for preterm labor. So your doctor would do an ultrasound on the cervical length, and if they feel that the length is small, so you have a chance of going into preterm labor, and probably your length is small. That's why they want to do that. So, I mean, it's an individual judgment. So I cannot sit here and say whether it should be done or it should not be done. So it would be probably been advised depending on the finding that you have. So you can go ahead. It's a safe procedure. That's not such a big deal.
Thank you, ma'am. That is very, very informative. I hope it helps you, Geeta. Dolly says, hi, ma'am. My ET was on 19th May 2021 and 5-day FET injection. Ma'am, I'm taking progesterone injection, but took first two in the lower buttock. Will it be wrong since it is intermuscular? It is 10. It is 10 days today, and I'm too stressed. Till now, there are no symptoms.
So I don't get it. So you're stressed because you took intramuscular in the lower buttocks and you should be taking in the upper buttocks. It doesn't really matter. I mean, it's all right. And progesterone can only help you to a certain extent. And the pregnancy has to take up on its own. So hopefully things will turn out uh, and well, but there are a lot of factors which really affect the uptake of things. So it's not just one single progesterone injection, or two injections of progesterone, or where you have taken it. So there are a lot of things which actually affect the success of IVF. So and stress is one of the biggest things. So I think you really need to relax and see how things turn out.
Thank you, ma'am. Ma'am, Shiny has a question here. I'm 17 weeks pregnant. Would you recommend vaccination at this stage? I think you already covered, but she would have joined late.
Yeah, so I would again reiterate the fact that right now, as of now, I cannot advise vaccination in pregnancy, but we are awaiting guidelines. We are awaiting because there have been a lot of discussions. So maybe by next week, we should be having some guidelines which say that it is allowed. But right now, as of now, no. But yes, in lactation, we can allow. In breastfeeding, mothers can take vaccination in pregnancy. Before conceiving, please take vaccination. Before planning pregnancy, please take vaccination. During menstruation, please take vaccination. All other times, please take vaccination. During pregnancy, some things are going to come out very soon.
Thank you, ma'am. Uh, I see a question here. Mahfouz says, I think we'll have to reply to him in Hindi if possible. मेरी वाइफ 3 months pregnant है and during intercourse उसको ज़्यादा पेन होता है. So what do you suggest?
So, प्रेगनेंसी में मतलब ऐसा कोई दिक्कत होनी नहीं चाहिए. जनरली इंटरकोर्स ड्यूरिंग प्रेगनेंसी इज सेफ. जो 3 महीने के बाद चौथे से लेके 7वें महीने तक इंटरकोर्स हम सेफ मानते हैं, अगर प्रेगनेंसी में कोई और दिक्कत नहीं हो, जैसे कि आवल नाल नीचे नहीं होनी चाहिए, प्रेगनेंसी में कोई ब्लीडिंग नहीं होनी चाहिए, और इस तरह की कोई दिक्कत जैसे पेन होना या लीकिंग होना, इस तरह की दिक्कतें नहीं होनी चाहिए. तब प्रेगनेंसी में इंटरकोर्स को हम सेफ मानते हैं. तीसरे महीने के बाद तो पहले के 3 महीने और 7वें और 8वें महीने के बाद हम इंटरकोर्स को अवॉइड करने के लिए हम बोलते हैं. बाकी ये है कि इंटरकोर्स में पेन होना वो प्रेगनेंसी स्पेसिफिक नहीं होता है, वो उसके पहले भी हो सकता है, बाद में भी हो सकता है. तो उसके लिए कुछ जेली का इस्तेमाल कर सकते हैं, या अपने डॉक्टर से भी एक बार पूछ सकते हैं कि कोई और दिक्कत जैसे कि एंडोमेट्रियोसिस की दिक्कत ना हो और उस तरह की कोई और दिक्कत ना हो.
Thank you, ma'am. Prabjot is asking, is it okay to have heartbeat more than 110 in the 4th month? And she has one more. I saw it fluctuating between 107 to 180 today.
Mother,
Uh, yeah, Prabjot, is this yours or is this your baby's heartbeat?
yeah, so if it is actually more than 110, I think she needs to be evaluated. Because first of all, you need to look whether what is your status of your thyroid, or whether you are very, very anxious, and what is, and something called a sleeping heart rate भी देखना पड़ता है. And it is always better to get an evaluation done with a medicine person. Get the ECG done. So that is one more thing. It's always very good to get the medicine consultation done, get your thyroid status checked, get one ECG done. These are the three things, because 110 baseline is a little higher and 180 is definitely higher. So I'm not very comfortable with this report, so I think you need to consult somebody. Yes.
Thank you, ma'am. Riddhi is asking, can I use Indian toilet?
Which month of pregnancy? There is no contraindication to using that, but
31 weeks pregnant.
yeah, so I mean, you need to be careful always. So that we generally, in our wards, I work in AIMS, so in our wards we generally have both types. But what I would say is that whenever we send our patients home, uh, all of them do not have Western toilets, definitely. But what we do advise is that keep your doors open, do not lock them, and have an attendant at home at all times. So you generally need to take these precautions, then it would be fine.
Thank you, ma'am. Sushmita says, I am IVF pregnant, feeling a bubbling sensation in my lower abdomen. Last day, one spotting noticed. However, there is no pain or further bleeding. Anything I need to worry about? I have my anomaly scan scheduled for next week.
Okay, so that should solve a lot of problems. Number one, because any so we just really need to remember one important rule in pregnancy, that any kind of bleeding is not normal. So I would say that even a spotting, mild bleeding, severe bleeding, we will not be happy with any of it. So there might be reasons which explain these things. So bubbling in the stomach is fine, because that would be a little amount of flatulence or gas. So that is what we call. Or even sometimes for primary patients, first babies, when they do not understand, movements are known, they come across as bubbling. So we don't know about that. So bubbling is something that I'm not too worried about it. But if you have even one single spot of bleeding, I would look into it, like what it was. So, but because you have your anomaly scan coming up, we can look into where is the placenta. What is the localization of the placenta? Maybe it is slightly on the lower side, and or if there is something very small amount of something what we call a retroplacental clot, or some collection behind the placenta, which can explain your bleeding, and otherwise the baby is growing normally. So please remember, any type of bleeding in pregnancy is not acceptable. So rest everything is fine.
Thank you, ma'am. Ma'am, Mano says, I have conceived through IVF and I'm now in the 32nd week. I was given Geston injection initially in the first and second month for almost 50 days continuously, which the pain in both the buttocks and my thighs still persists. Intensity has decreased, but since it's the third trimester, I've been advised to sleep in lateral position, which I could not do because of the lateral buttock and thighs. What can I do to subside this?
So yeah, I understand, because progesterone injections are given early on in the pregnancy and middle of the pregnancy, so that pregnancy is supported. See, uh, I would say that lateral position can be both sides, not just one side. It could be left lateral, right lateral. Also, just use some hot fomentation, and there is something called thrombophobe ointments which come, which can, you know, uh, ease off the swellings that you had, and you can always use some hot fomentation to decrease the pain. And you can frequently change sides, but yes, it is important that you lie on your sides and not on the back, because when you lie on your back, what really happens is that the flow to the baby will come down. So that is the reason we ask patients to lie on the sides. But it is not important that it is left or right. So please keep changing the position. Please keep pillows under your thighs or buttocks, so that you can make it softer. But it is important that you lie in your sides.
Thank you, ma'am. Is it safe to travel by flight in the 13th week of pregnancy?
Yeah. So if you see, most of the flights have regulations that you can travel up to 32 weeks. But please remember that in pregnancy, we say that there are two periods that are risky. One period which is safe. Up to 12 weeks is, we say that you be more careful, and beyond 32 weeks, please be more careful. So in between them, you can do anything, like between, in the second trimester is the safest time, even whether it is for travel, whether it is to work, whether it is for surgery, anything that we want to do, second trimester is safe. So for travel, no problem, unless There are certain indications like, you've had some problems or you've been advised blood bed rest, there is placenta is low lying, you've had some bleeding, you have some problems, then we say restrict activities. But otherwise, normal pregnancy, no problem.
Thank you, ma'am. Pratima is asking, I am having twin pregnancy by IVF, but unfortunately, one fetus had birth defect in the brain, and I'm undergoing fetal reduction of one baby. I just wanted to ask if the reduction will cause any risk to another baby, especially if I have a short cervical length. Now, Shifa also has a related question. She says, is cervical stitch absolutely necessary in IVF twin pregnancy?
Very good, complicated questions they're asking. I'm really impressed. Actually, I thought about covering all of these things, but anyway. So, first thing, that the first question is that I would like to know that if she's undergoing reduction, what is the period of gestation? When is this happening?
14th week.
Okay. So, as I mentioned, reduction at 14th week is reasonably safe and the risk is less than 5%. So, the risk of reduction would be, this is what we give our patients, that it is around, 5 in 100, less than 5 in 100. So, this is the risk that we would give them. It is reasonably safe, and I hope that it's a dichorionic twin. I don't know if she can mention that to me, that it's a dichorionic twin.
Uh, Let me check. Pratima, can you put it in the chat box?
That is a very, very important aspect, that it's a dichorionic twin pregnancy. Then coming to
Yes,
the
she
other,
says yes.
okay, then that's what the risk is. So it is like, five, less than 5% risk. So don't worry about it. Safe procedure, single needle prick. They will just put one KCL into the fetal heart, and it is just hardly takes 5 minutes. And the entire procedure is just one single prick and five less than 5% risk. So it should be all right. Now, for the second part about the cervical stitch, it is not a routine. But for the first patient, also, I would say that because her cervical length is slightly lesser, 1.5, that puts the pregnancy at a higher risk. But then there's sometimes you just have to go with the risk because you don't want to continue the other one and place the entire thing at risk. So, whenever the cervical length is less, yes, things just get a bit more complicated. Now, for the second patient, I would say that for our practice, we don't routinely put stitch in an IVF twin pregnancy. There is no indication to put cervical stitch routinely in an IVF twin pregnancy unless the cervical length is less. So, putting a cervical stitch has certain indications. Like in the first case, if the cervical length is 1.5, I would put. But if the cervical length is more than 2.5, I will not put, because every procedure has its own problems. Putting in a cervical stitch itself might cause abortion. So all of these are something that needs to be counseled, that needs to be understood. So please ask your obstetricians. I'm sure they are taking those decisions based on experience and after knowing, your background conditions nicely.
Thank you, ma'am. So I'll be taking more queries regarding IVF. So please pardon me, everyone, if I'm missing out your other queries. Uh, we just have 10 minutes left, so we'll cover as much as we can. Deepika says, I'm 21 weeks IVF pregnant. I got COVID last month. I'm fully recovered now, but I'm feeling very lethargic. I cannot walk for more than 10 minutes and not able to do yoga also. And on top of that, she's not able to sleep as well. Please help.
Yes, so I would like to say that COVID. We have seen that COVID really is affecting everybody really hard this time, and pregnancy especially. So don't take it so hard on yourself. Give yourself at least 3 to 4 weeks more to recover. Please do not even attempt yoga right now. But what I would say is this: just do some basic exercises, keep yourselves active. What is important is we know that COVID is a situation in which small microthrombi are formed. COVID is a procoagulant condition. So keep yourself active. Do not think that I had COVID, so I need to be on the bed. And yes, you will feel weak, but keep yourself hydrated and keep walking, just inside the house. Be active. Just consult a physiotherapist for some basic exercises where you can just move your hands, limbs, keep yourself active. So that's the most important thing that you can do at your time. But don't force yourself, or just feel bad that you're not able to do exercises, because uh, we have seen doctors, patients who are not pregnant also being affected for one whole month or so. So pregnancy has been really severely affected. So please give yourself that kind of a leeway, that okay, I will take more time. And uh, and now that you have thankfully recovered nicely, weakness will go in another few weeks. So don't worry, but keep yourself active. Very important.
Thank you, ma'am. Mano says, I am 34 years old and I have my IVF pregnancy. I have GDM right now. Is there any possibility that I can go for normal delivery?
Yeah, so as I said, you are 34 years old, you are GDM. The mode of delivery really depends on the what is the weight of the baby. Okay, what would be the presentation of the baby? Is the baby head down? And what is your pelvis like? What is the size of the pelvis? So it's all about the size of the pelvis versus the size of the baby. Whether you go into labor, whether you will need induction. Like GDM is not such a big problem. For GDM, if you're on diet, then you can even wait for spontaneous onset of labor, unless you are on insulin, when you will need induction. So you are 34. So at 37, your obstetrician will assess you again and see how is everything placed, and they decide accordingly. So you do have a fair chance of normal delivery. GDM itself is not a reason for cesarean section. So there has to be other things to be seen. If your baby's size is good, your pelvis is good, you can do have a chance at normal delivery. Don't stress. That is the most important thing.
Thank you, ma'am. Moving on to the next question here. Dr. Diti says, Hi, ma'am. I have a single IVF pregnancy. I'm at 12 weeks and taking Proginova progesterone and Sustain gel. When can I stop these medicines? Baby's growth is normal.
Yeah, so generally, these protocols differ from place to place. We stop it very soon. Even after 6 to 7 weeks, we do stop all of these things. But by 12 weeks is a high time to stop, and most people do stop after 16 weeks. So you see, these things generally help till HCG is actually supporting. So by the time the placenta has taken over, most of these hormones are not needed anymore. So by 12 weeks, your placenta is well formed and the baby is well formed. So you don't need so many supplements anymore. Proginova is definitely not needed anymore.
Thank you, ma'am. I see, Dr. Neha Baga, you have posted your queries again. Ma'am has already answered it in detail in the beginning, of this session. So I would request you, after this session, you can just go have a look and get your answer from there. Meghna says, I'm 21 weeks pregnant. I have a low-lying placenta. It's an IVF pregnancy. Is there something to worry about?
Sorry, can you repeat the question? Yes.
Yes. Meghna says, I'm 21 weeks pregnant and I have a low-lying placenta. It is an IVF pregnancy. Is there anything to worry about and what should I do?
Yes. So, as I mentioned, so low lying placenta at 21 weeks, currently, don't worry. Now, the protocol is that at 32 weeks, we do something called localization of placenta ultrasound, and we will see. So, there is something called a placental migration, where the placenta would be probably be seen in the upper segment by 32 weeks. Now, if it has not it is not seen in the upper segment by 32 weeks and it is still in the lower segment covering off, then in that case, you would require a cesarean section. The other thing is that when the placenta is low lying, there is slightly increased risk of bleeding and on all of those complications. So we need to be a little more careful about it, but not that you restrict your activities or be on bed rest or something like that. But yeah, just be more careful with those things. So this is all. But yes, you would need a repeat ultrasound at 32 weeks, and that is what you need to be careful about, because that would decide on the mode of delivery, whether you can undergo a normal delivery or not, because a low lying placenta in the lower uterine segment is uh, depending on the grading of placenta, you can undergo a normal or a cesarean section.
Thank you, ma'am. Ma'am, Priyanka has a question for you. She says, I'm 20 months pregnant and it is an IVF pregnancy. Can I change my gynecologist after the 7th month?
That's your choice. I mean, that's a personal choice, Priyanka. You need to look into why you are not wanting to continue, whether the facilities are there for a good delivery. As I said, most important thing is have a good obstetric facility to deliver. You know, that facility should have a good neonatologist to handle a preterm delivery, a good gynecologist to handle complications if happens at the time of delivery, and a good OT facility. So if all of these things are there, you can continue. If you think that there's something is lacking, you can change.
Thank you, ma'am. Priyadarshini has a question here. Can one conceive naturally after two IUI failure? Is IVF the only treatment left? It has been 3 years that I've been trying to conceive.
You know, what we have actually seen is there's something called an unexplained infertility. So there are tubal causes, there are ovarian causes, then there are endometrial causes, and these are something that we know of. But in a woman, in a man, and then of course there is the husband factor. Now we investigate for all of those things. Now suppose there is no cause which is found, and then there is still the couple is not able to conceive, then we label them as unexplained infertility, and then we advise them IUI and IVF. So we generally, the protocol is that you go for say 4 to 5 cycles of IUI and then you go for IVF. If on some cycles you have not conceived, then you go for IVF. So it has been seen, very commonly seen, that you've tried for 4 to 5 cycles of IUI and you said, okay, I'll take a break, and then they conceive in between, because that's unexplained IVF. But if you have a reason, like say for example, if you have a tubal factor, your tube, we know that your tubes are closed, then in those situations you cannot, so you have to do something about it, right? So you cannot conceive without IVF. So you have to see and understand what is the cause for your infertility, and depending on that you need to see whether you can conceive normally. So it is not that after two failed IUIs you cannot conceive. So depending on whether it's an unexplained IVF, whether it is an ovarian factor, whether it's a tubal factor, whether it's an endometrial factor, the chances do remain. And we do have seen patients conceiving even after failed IVFs because it was an unexplained infertility.
Thank you, ma'am. Ma'am, Nivedita has a question here. I had conceived twins through IVF, but in the 6th week scan, only one fetus lost the heartbeat. So now I have a singleton pregnancy. I wanted to know if my single pregnancy would be okay as growth is concerned.
Yeah, this is a very common thing which we call as vanishing twins. So this is fine, no problem. Vanishing twin can occur because you know, when you have twins, one they have different genetic material, and one of them was non-viable, so that baby did not survive. So the other one can continue, and you treat that as a singleton pregnancy and continue and be very careful with the monitoring and, you know, the continuing the growth. So there are certain protocols which differ in that, but yes, I mean it's a very manageable pregnancy with a good outcome, no problem.
Thank you so much, ma'am. Nandini has a question for you. IVF pregnancy, 22nd week. I am on Prolutin depot
Yes.
injection weekly. Is there a problem if the injection is taken at 8-9 days gap, or is it like fixed for 7 days?
See, proliton injection is something which is given to prevent a preterm labor. So it is given weekly, preferably. So even if you have taken it like 8, 9 days, sometimes doesn't matter, but prefer to take it weekly. There has to be an indication for giving proliton. Uh, Only for IVF you can give. So even if you take or miss a few doses, doesn't matter.
Thank you, ma'am. I think Rashmi would have joined late. So she's asking a question to you. Hi, ma'am. I'm 33 weeks pregnant with IVF twins. Last scan was done on 32 weeks, and both the babies are fine, 1700 and 1800 grams respectively. My blood tests are normal, and the doctor has suggested to go for C section at the end of 36 weeks. Uh, is it okay to do early delivery?
So twins is a completely different matter altogether from singletons. So in twin pregnancy, whether IVF or normal, you need to have an ultrasound 2 weekly. Uh, for a DC twin, you have to have ultrasound 4 weekly, and for a monochorionic twin, you need to have an ultrasound 2 weekly. And as far as delivery is concerned, if it's a dichorionic twin, it's called a DC twin. You need to deliver at after 37 weeks, between 37 to 38 weeks, if there are no complications. So I don't know if you have any complications, but if it's a monochorionic twin, DAMC twin, monochorionic twins, so it's okay to deliver between 36 to 37 weeks. But if your doctor has asked you to deliver at 36 weeks, so I wonder if you have some complications. But anytime, so we would say that 37 is a good time. 37 weeks to 38 weeks is a good time if you have no complications and you are a dichorionic twin. But if you are a monochorionic twin, then 36 weeks is a good time.
Thank you, ma'am. Just taking a few questions from here. Bhavya says, I'm in the 4th month of pregnancy. My TSH is 16. Is it dangerous to the fetus?
Bhavya, I would say that 16 is high, and but none of the guidelines say that you should terminate the pregnancy. But yes, I mean there could be an effect on the baby. You should control the TSH as soon as possible. Uh, the baby, you might have increased risk of blood pressure, high blood pressure, preterm delivery, risk of abortion. The baby might have some problems later on, but there is no definite risk or percentage that I can tell you because it is not quoted in the literature. But I would say that yes, I mean it is definitely a risk factor.
Thank you, ma'am. I think, Hiral, you've asked if BP 100/68 is okay. And I think there are more people who have asked about blood pressure. So, ma'am has said ki, I think you are only supposed to be
140 by
concerned
90.
about the
Yes.
higher level, right?
Yes. The lower
So,
level, everything, as long as you are able to write that is 100/60 okay, and then that means you are fine.
correct, correct. Thank you so much, ma'am. Last question, I think Payal says, until when is it okay to have cramps like periods? I have increased my water intake almost double. Is it okay? I'm in the 6th week of pregnancy.
Yeah, so I think period like cramps is something like the initial part where the uterus is having adjusting to the fact, and maybe you would need some progesterones and things like that. So not a very good sign, I must say, and I would also say that not many medications can help you with that. So just a bit of rest and medicate water intake. Just if you feel like having water, have water. Has no not much of a relation with pregnancy. But if you think that it is like excessive water intake with a lot of hunger has also increased and you're having a lot of polyuria also, maybe get your blood sugars checked. But no direct correlation with pregnancy, I must say. But the cramps, there's nothing much that you can do about it except that maybe take progesterone to suppress them for some.
Thank you, ma'am. Uh, if cervical length is around 2.6, is it safe during fetal reduction?
Yeah, that's fine. More than 2.5 is fine.
Great. Okay. Thank you so much, ma'am, for patiently answering all those queries. And to all the users whose queries we missed out, please post it in the feed section, and one of our experts will revert within 24 hours. And ma'am, thank you very much for joining us for the second time, and we look forward to having more sessions with you in future.
Okay, thank you. It's been great. Thank you so much.
Thank you, everyone.